If you're one of the many people who suffers with pain in your ankles, knees, hips or back when you're going up or coming down stairs, then don't go anywhere because I'm going to show you exactly how to fix it. If you don't know who I am, my name is Will Harlow and I'm the Over-Fifties specialist physio here at HT Physio in Farnham. And today I'm going to be showing you one incredible exercise to help you fix pain on stairs. Now I'm going to show you the exercise in just a moment, but before I do, I just need to let you know that this exercise is not going to be suitable for everyone. Do make sure you get checked out by your doctor before you give it a try, and if it causes you any pain, just avoid it. Anyway, let's have a look at the exercise now. Whenever I see a patient who comes in and tells me they've got knee pain or hip pain or ankle pain as they go up or down the stairs, there's often one muscle group in that person that isn't working properly. And that muscle group I'm talking about are the hip abductors, and that is this group of muscles here. Now, the hip abductors are responsible for this movement here, bringing the leg out to the side, and they're primarily your gluteal muscles or your upper glutes. So if you find your waistband on your trousers or shorts and you come about 1 inch or 2 inches below, these are your hip abductors here at the back of the hip. Now these little muscles are incredibly important for human movement. One of the things they do is they control your pelvis. So as you go from one leg to another, especially going up or down stairs, they stop your pelvis from dropping down to one side. They also do that when we walk on flat as well. Now the other thing they're responsible for is maintaining the alignment of your leg. So if you're coming downstairs, if you've got good hip abductors, your leg should stay nice and straight. That means there's minimal stress on the knee and minimal stress on the ankle and the hip as well. However, if you've got weak hip abductors, when you're coming downstairs especially, this can happen. And that movement there, we call that valgus. And that basically means that your knee is crossing over the midline of your body. Now you can get away with that a few times over. Your brilliant body is good at compensating for things like this, but if you do it over and over and over again, you're going to get a lot of stress, particularly on the inside of the knee and your ankle and your foot, and also the outside of the hip. Now this can also be the case when you're coming upstairs as well. So if you're coming upstairs and you don't have good hip abduction strength, then this happens. Your knee crosses over your midline and you're putting a lot of stress on your knee. Now this doesn't have to be as obvious as how I demonstrated it for it to be a problem. Even just a few millimeters of valgus can lead to problems over time, and we see that time and time again, both in my practice and in the research papers online. So fixing weakness in the hip abductors is key to preventing knee pain or hip pain or ankle pain on stairs. And it will also help you if you've got back pain as well, because weak hip abductors are definitely associated with back pain too. So I'm going to show you one great exercise to fix your weak hip abductors. It will also help you to build strength elsewhere in your legs. So it's a fantastic movement. It's brilliant for most people. And if you're struggling on stairs, this is really going to help. Let's have a look at the exercise now. So here's a great exercise to strengthen those hip abductors. I'm going to give you 3 variations, and I'm going to do 3 because I know not everyone can do the hardest variations of this exercise. So we've got an easy version, a moderate version, and a harder version to help you. Your goal really is to try and work up towards the hard one if you can, but if you can't get there, don't worry, because the other ones are going to help you just as much. Now, to make these exercises work, we do need a tool. We're going to need a resistance band, and I've got 2 types. This here is a purpose-built glute band, and these are ideal for this exercise. It's basically fabric which has got some really tough elastic in it, and it wants to be pretty heavy to make this work. But if you don't have access to one of those and you can't get one, you can get yourself some of this, which is just like latex-free resistance band. This is super cheap to buy online. I think you can buy about 1 meter of this for £1 or $1 from Amazon. That's sort of where I get mine from. And you can cut it, you can tie it into a loop, and we want it in a circular loop like that. So that's one thing you can use. I'm going to use the glute bands just because it looks better on the video, and that's probably what I would use at home for this. And what you're going to do to make this work is slip the glute band around your knees, and you want it just above your knees, and you want to be sitting in a nice firm chair. Now for the first variation of this exercise, we're going to lean back into the chair so our back is rested against the backrest. And this is important because then it knocks out your back muscles, so you're not going to be tempted to use them. And this is especially important for people who already have back pain. So you're going to lean back against the chair like this. You're going to have a bit of tension on your band by just pushing out into the band like this. You're going to take your feet slightly further apart than your knees. It doesn't have to be that much further, but just an inch maybe. And then all we're going to do, keeping our back rested against the chair, is push open into the band, trying to separate our knees and really feeling the muscles on the outside of the hip contract. Hold for a couple of seconds and then slowly bring them back in. I'm going to show you again. So we're going to push out, contract like this, hold for a couple of seconds and then come down. And this exercise works to help relieve your pain on stairs because it's waking up those lazy glutes, those hip abductors that aren't working very well at the moment, reminding them that they need to do their job so that the next time you climb stairs, you're going to be in less pain all over the lower limb as a result. Now you can see here I'm pushing open, holding for 3 to 5 seconds, then coming back. And I can already start to feel those muscles there getting a bit tired. They're almost like groaning at me a little bit because they're not used to doing this movement. And that's a really good sign. That's actually what we want. Remember, if you can't feel a muscle working and it doesn't feel tired, not much has happened. So we want to get to that point where there's fatigue. We want to get to that point where it's aching and it's telling you, oh, you've done enough, you should stop. And that's a great sign that you've just done a good set of an exercise. You might want to do this just before you go out walking or just before you know you're about to go and climb a long flight of stairs if you can. This would be the perfect time to do it. And I almost guarantee that after doing this exercise, if you went and climbed stairs right away now, you'd have less knee pain as a result. It works for about 80% of my clients. So that's the first variation. Let's move on to the second. And what we're going to do now is very similar, but this time we're just going to bring our back away from the backrest, shuffle forward, and have our back upright like this. And the reason this is harder now is because your lower back muscles are going to try and take over, but we want to try and focus that contraction on the glutes. So we don't want the area above the waistband to be working. We want the area below the waistband to be working instead. So this time we're going to sit up tall, back unsupported, feet slightly wider than knees again. You can have your hands on hips if you want. And then again, we're just going to push out into the band. Try and keep the back relaxed, but tense the hips, if that makes sense. So we're pushing out into the band, holding for a few seconds, and then relaxing back in. And then repeat again. So push out into the band, squeeze, hold for a few seconds, and then relax. And again, we're going to go out into the band, hold and squeeze, and then relax. Now for both of these exercises, I would recommend working up to sets of maybe 15 repetitions. 10 to 15 works really, really well. And then trying to do that maybe 3 times per day. That would be a good repertoire for you to get you moving. So once you've done your exercises like that, if that was easy for you and you're ready for the next step, we're going to combine a sit to stand movement with a band pull apart, okay? So to make this exercise work, you're going to stay on the same chair. This time you're going to come right to the edge of it, just so you're perched on your sitting bones. Again, we've got our feet ever so slightly wider than our knees. And if you look now, I'm in that valgus position, but we're going to actively try and correct it. So we start in valgus and then we push out. So we're in neutral. So I've got those glutes switched on. Now I'm going to take my hands across my chest, bring my nose over my toes and come forward and up and stand. And then when I'm at the top, I'm now going to put it in reverse, still pushing out against that band and slowly dropping down without letting the band pull me back in like this. Now this is much, much harder. So you're not going to be able to do 15 of these in a row if you've got a tight enough band. We're probably looking at maybe 5 in a row, but that's a great way to build strength. So I'll show you again. We're going to push out into the band, hands away, put our nose over toes and stand up, keeping those knees pushing out into the band. And then down, same thing. Don't let the knees come together. Don't let the knees come together. Stick your bottom out and sit down like that. And you'll feel that your knees want to pull in at the end of the movement, which is fine. You can allow them to rest. One more time. We're going to go out. Bring our nose over toes. Keep the knees apart. Push up. Again, don't let the knees ping in. This is the hardest part of the movement. Sit down and then allow it to rest. So it's a great way to strengthen the legs. You're also going to get your quads working with this movement. And the reason I like it is because as we're coming downstairs, the quads have to lengthen as they contract, which means that when we're doing this sit to stand and we're coming back down, we're practicing that exact movement. So it's very relevant to helping you climb and descend stairs. So hopefully that works. With that final one, you're going to do 5 in a row, try and do it 3 times a day, and over a period of a few weeks, I can almost promise you that you'll have less pain all over the lower leg on stairs. So that's my one incredible exercise that you can use to reduce pain on stairs. It's useful for a whole host of different things as well. So it's a great exercise for many people watching this. And I hope this video has been useful. If it has, do drop a comment below and just let us know, because it does help us to improve these videos in the future. And if you want to get more from me, you can pick up a copy of my book. It's called Thriving Beyond 50, and it's got loads more tips, tricks, and advice like the stuff in these videos inside. So please do pick up a copy if you're interested. Anyway, thank you so much for watching. I really appreciate your time, and I'll speak to you on the next video.